Are we eating and taking prenatals to make sure we're getting enough folate and folic acid? Nutrition is not one size fits all. What we eat really comes down to where you're starting from, what resources you have, what your lifestyle is, who you live with, what your cultural foods are, right? What your preferences are. Every woman of childbearing age, making sure they're taking enough folic acid.
Okay.
Right, so 400 micrograms a day. The more plants, the better, is what's going to give us those micronutrients that's going to fight that oxidative stress. Pumpkin seeds, you mentioned flax seeds, they're rich in omega-3s. And that is completely associated with improved reproductive hormones. Canadian recommendations are 150 minutes of physical activity a week. Are you eating, period? I'm taking all the supplements, I'm exercising, I'm sleeping, and then we look at their dietary history and they're eating maybe like a really light salad, build some structure into our day to fuel. So stabilizing blood sugars is a big piece of fertility support. When it comes to stabilizing blood sugars, meal timing. I always recommend for anyone who's trying to conceive, right? As a woman, eat your breakfast with protein. How do we now address that compulsive or emotional eating? Your body is resilient. Your body is so much stronger than you think it is. Your caloric needs actually don't increase in the first trimester. It's only in the second and third that it's extra 450 to 550 calories per day. It's a woman to second trimester, if you weren't able to tolerate breakfast, or maybe you're transitioning now, how do we add a little more protein into the morning? 3 things to think of. 1, what is the type of carb that we're eating? But 2, are we eating high fiber carbs? Are we spreading it out throughout the day? Eating all your carbs in one sitting is very different from spreading it out throughout the day. And 3, are we pairing it with protein and fat? Insulin on its own is not actually meant to be harmful. Why do I have PCOS? Why me? Pillars, nutrition, gentle nutrition, I like to call it. Exercise, movements, right? We talked about that. Stress resilience, right? Our nervous system support, right? And then sleep. There is a correlation between vitamin D and reproductive function. There is a lot of validity to traditional healing practices.
The minute you see those 2 pink lines, everything changes, including the way you look at food. Every ingredient, every craving, every late night Google search could feel like it matters more than ever. And the advice out there, all the information that you see online, it could be confusing, conflicting, and it's just full of noise. So to just cut through the noise, I'm here with registered dietitian and the founder of Nest and Nurture, Trista Chan. Thank you so much for joining. And tell us more about your work.
Hi, thanks so much for the warm welcome. And I always love collaborating as well, so thank you. So I'm Trista Chan. I am a registered dietitian and founder of Nest and Nurture, formerly known as the Good Life Dietitian. So we are a virtual nutrition and lifestyle platform for women who may be experiencing hormonal conditions such as polycystic ovary syndrome, endometriosis. Maybe they have a PMDD, maybe they're undergoing perimenopause, right? And of course, patients in the fertility space from preconception all the way to postpartum, we're supporting women truly in all life stages. And we really center beyond just what to eat, their relationship with food and seeing our patients and our community members as whole people, right? Because it's not just about food. It's about our relationship with food, our bodies, our culture, our identity, how we feel at home or not at home in our bodies, right? If there's a history of trauma, our lived experiences. So it's really amalgamating the science piece and that human connection through our platform.
Interesting. So it's all about the relationship with food. It's beyond the ingredient. It's beyond what we see right in front of us. Mm-hmm. Right. So let's start from the beginning.
Yes.
So there's a pregnancy phase and then there's a pre-pregnancy phase, which we call TTC or trying to conceive. So couples who are planning for a baby, more so women, the first instinct is they just want to Google. So, and there's so much information online. So they end up searching which food is best for me to get conceived, or for me to conceive, or how do I get pregnant fast, or which food would help me with the fertility health. And like I said, there's so much information that it adds more stress. And they end up feeling that they're doing everything wrong. So for a woman who's trying to conceive and who wants to work on her body first, where should she begin with and what are the foundations?
Such a good question. And you're right. Like we live in the internet age, right? There's the information age. There's Google, there's ChatGPT, there's Reddit, there's TikTok. And on the one hand, I love that it breaks down so many barriers. But it's a little bit of a double-edged sword, right? You're now inundated with all this information that we're not really designed, I think, our brains. Now, I'm not a neurologist, right? To actually receive and contextualize. And that can create so much confusion and shame, especially with nutrition, because for most people, to a certain degree, it's one of those few modifiable factors in our life, right? Genetics, we can't change. Environment, to a certain degree, we can't change. But food, yeah, I can decide when to eat, when to stop, what to choose, right? What to add, what to take away. So for people who are looking to conceive, are in that preconception, that TTC, that trying to conceive phase, right? I always say, okay, let's take a step back. Let's not jump straight to Google. And I always start with you as a person, right? So if you were trying to, knock on my door and saying like, hey, I want to get pregnant in 3 months, 6 months, what do I do? I would ask you, like, what are you currently doing? Actually, because every person's body is so different. Like, yes, there are certain principles that typically would improve chances of conception, right? Things like adding more anti-inflammatory nutrients, antioxidants, really, really beneficial, omega-3 fatty acids, right? Are we eating and taking prenatals to make sure we're getting enough folate and folic acid, right? So there are those dietary guidelines, but let's start with what your baseline is first, because nutrition is not one size fits all, just like how everyone's fertility journey and postpartum journey is also not one size fits all. What we eat really comes down to where you're starting from, what resources you have, what your lifestyle is, who you live with, what your cultural foods are, right, what your preferences are. And then I work with you to say, okay, where are the gaps? Maybe it's that we aren't eating enough omegas. How do we insert that in? Maybe it's that we're not eating enough fiber, a core part, a really simple yet overlooked part of an anti-inflammatory eating pattern. How do we add them into your day? Right? So another key thing is, instead of thinking taking away foods, which I think a lot of the dieting advice we see online is centered around, we're thinking nutrition by addition. How do we add more fullness into our lives and more fullness into our bowls, into our plates, and get your body to a state where the reproductive function, right, the baseline is a little bit stronger.
Right. So we just spoke about prenatal, right? A lot of women end up taking once they get pregnant. But often it's advised to start early. And so thankfully, I was just like, I just started taking like 6 months prior to my pregnancy. And how early should they, is there like a timeline when they should start with the prenatal?
Yeah, great question. It is recommended 3 months before conception. But that said, sometimes it's a surprise, right? So the recommendations actually are that every woman of childbearing age, making sure they're taking enough folic acid, right? So 400 micrograms a day or folate, and that's just to make sure that we're preventing or reducing the risk of neural tube defects, especially in the first trimester, right? Because sometimes we don't know we're pregnant, right, for the first few weeks, right? So that's really key to build that strong foundation and those nutrient stores. So 3 months, but you know what? Like, think of it as just like a multivitamin, but but like super powered, right? So if you kind of have an idea that, okay, I might be starting to try soon, like, better safe than sorry, I say just pop in a prenatal.
So there's some form of supplement which has to go in.
For pregnancy, yes.
Pregnancy.
Absolutely.
Understood. And also it's advised to take prenatal during postpartum as well.
So technically it's not part of the guidelines per se, but I often do recommend it for new mothers postpartum, just because the things that your body may go through during childbirth, right? There's a ton of blood loss. Now, I don't have to tell you, right? There's a ton of blood loss. We need a lot of replenishing the iron for the red blood cell production. There's things like, some prenatals now have choline, right? So if you're breastfeeding or chest feeding, for example, that's going to help support the milk quality as well. So, and then there's also that behavioral piece. So there's that nutrient stores, but also postpartum, and totally understandable. Like, most people aren't necessarily able to eat a diet that checkmark meets all their macro and micronutrient needs, right? So just think of this as this additional support that can't hurt in this next phase of life.
Right. Yeah. Especially when you're weak. I remember when I was, because it's still fresh in my head. It's just been 6 months. So I was not taking. And then a friend of mine suggested that you should continue with it because as such, you're tired, you're exhausted. So we do need energy. There's some form because we're feeding the baby as well. So it's pretty much essential for us to start taking prenatal as well. Like you said, it wasn't the doctor who told me that I should take. Yeah. I came across a post where foods which could maximize your fertile window.
Oh,
It was
interesting.
pretty interesting because there were a lot of foods which were listed. One for the egg quality, for example, avocados or eggs to improve the egg quality. And for cervical mucus or for estrogen, there were other foods like carrots, nuts, walnuts, sweet potato. So again, pumpkin seeds for, what was the other one? Pumpkin seeds for ovulation. So is it true or is social media just exaggerating the fact that about the fertility nutrition?
Yes, such a good question. And like, absolutely, you'll see little sound bites everywhere. That's like, this food directly correlates with this hormone, right? And this will boost this hormone and this will decrease estrogen, right? So it's like a yes and no. In reality, our bodies are so complex and nutrition is so complex that it's, yes, these nutrients and foods will support your hormone balance, but it's not as direct of an approach, right? So think of it this way. Our body, it's like a waterfall, right? If we're eating enough, of course there's the protein, calories, the carbs, the fats, but all those foods you're referencing, it's antioxidant rich. There's vitamin A, right? There's zinc, right? There's iron, magnesium, all these micronutrients. If we're more or less meeting those needs, think of that as having like a downstream approach, right? So there's that trickle down effects, and at the very bottom are the hormones like estrogen, progesterone, testosterone, insulin levels, right? Those are what's going to be a little bit more stable or within the range that we want it to be during different phases of the cycle, right? That said, these foods, right? Now there is a merit in terms of it supporting your phase, your cycle and your fertility, because when it comes to a fertility-friendly eating pattern, what we know we want is one that's anti-inflammatory. So a lot of these plant foods, like you're listing all these plants, right? The more plants, the better, is what's going to give us those micronutrients that's going to fight that oxidative stress in our eggs and our cells, right? They're also oftentimes like these seeds, pumpkin seeds, you mentioned flax seeds, they're rich in omega-3s. And that is completely associated with improved reproductive hormones and function as well, right? So there's some merits to it. We're not going to, start measuring and saying, okay, day 2 to 5, we're eating pumpkin seeds every day, and then 6 to 9, we're going to have sunflower, and then 10 to 14, we're having flax seeds. But if we're just incorporating these more into our day-to-day, then it's a kind of a surefire way that you're managing what you can from a fertility standpoint and thinking, once again, that nutrition by addition standpoint. But you know what? Like, if it gets people eating more plants, I'm happy about it. So it's also about you to decide like where that balance is, right? Between, okay, I know this is good for me, but when is it going past a point where it's like becoming like compulsive or stressful, or I'm trying to like adhere to external rules? Yeah.
Right. So it's all about a balanced diet.
Yeah, I know, it's so not sexy.
Right.
I know, like online, there's like it's balance, it's variety, it's moderation, it's adequacy, right? It's all these different principles, which is on the one hand like beautiful because it really is a lifestyle and it's fluid and you can make it your own. And you, at the end of the day, I always say like you are the expert of your health, right? I'm just like a co-driver. You have the map, I have the map, but you're deciding the destination and you're driving. But it's also can be kind of scary for some people who maybe like a little bit more yes and no answers, like a little bit more rigidity, right? But health is complex and it's beautiful and it's fluid and it's lifelong and it's always dynamic, meaning that you also have a lot of power within that too.
Understood. So diet is one part, which is essential. Another is lifestyle, which is very controversial because someone who's, if you're overweight, then you need to reduce weight. And if someone is underweight, then people are like, you need to put on weight. And then there's stress. And then there's, you need to sleep more. So how does stress, sleep, exercise, or even weight management plays an important role with respect to fertility health?
Oh my goodness, such a good question. And I'm going to talk about the stress piece first because I keep hearing this over and over again. Like, I think stress in itself, it's really important to differentiate what's eustress versus distress, right? What's a helpful stress and that we can build stress resilience towards versus something that's way past our stress load and thus harms our cortisol regulation and thus our ovulation, right? Is stress to a certain degree can actually create growth, right? For example, it's like getting married. Having a baby is stressful, but it's a beautiful, wonderful thing, right? And hopefully you become a better person for it or a more skilled person, right? When we cross the line, though, towards stress that is past what we can manage and past our load, that can put a lot of stress in our bodies and for certain conditions that may lead to infertility, such as for the case of polycystic ovary syndrome, PCOS. Now, there's research to suggest that cortisol, which is our body's stress hormone, naturally we want it to rise in the morning. That wakes us up and then decline. So we go to bed at day. It's a little dysregulated. It stays up, right? And that over time is what is associated as well and can impact the anovulation, the missing periods, right? Reduce, fertility as well. So stress absolutely plays a role. And when it comes to connecting that to nutrition, I always think of nutrition as it's a beautiful tool, but it is self-care. We don't want this to turn into another stressor and a form of self-control. Because I've seen so many cases where now the irony of, okay, I want to lower my stress, so I'm going to do all these hacks I see online. I have to do this 12-step skincare routine, and then I have to do a cold plunge, and then I have to somehow work and like be a human, and then that ends up being so stressful and the wellness burnout comes in. And I'm like, okay, but maybe that's what's, making it harder for you to conceive because we're trying to do too much at once and being a perfectionist. So stress to a certain, when it's too much, and it's also being honest with yourself as to what your intentions are when you're trying to manage stress, and also being honest with yourself with where your stressors are. If you're trying to eat 10 servings of fruits and vegetables a day and you're pulling out your hair trying to meet that, that's not healthy. That is stressful.
Right.
Right?
Yeah.
Yeah. And when it comes to, the lifestyle piece, right? We know that our lifestyle and nutrition, oftentimes our relationship with nutrition and movements, very similar. That could be if you're super restrictive and regimented and you're punishing yourself with food or with the absence of food or seeking a lot of, compulsive eating for comfort and numbing. Typically, our relationship with movement and exercise can reflect that. It kind of goes hand in hand, right? So with that same vein of, can we approach nutrition with nourishment, with self-care? Yes, there's those guidelines, but we're really adapting and making it our own. What about movements? The Canadian recommendations are 150 minutes of physical activity a week. But hey, that doesn't mean you're measuring and counting and you have to go to the gym 30 minutes a day at this time. What is a movement that you like that can seamlessly integrate into your day, right? And that you can sustain as well. So I always say, if you can't do something for 5 years, why do it for 5 minutes?
Right.
I'm in it for the long game, Yeah.
So talking about stress, another topic which I want to bring in right now is fertility nutrition is important for couples who are trying to conceive, but it becomes crucial when the couple or men or women or partners, they have issues. For example, low sperm count, low sperm motility, or it could be PCOS, irregular cycle, which adds more stress while trying. They do not know what to do. They're just trying, like we discussed, every post that they see, they're just trying with a vain hope that, okay, I'm going to conceive. Probably it's going to help us. So what does supportive eating look like in that scenario?
Such a good question. And if anyone's listening and they're experiencing that, I just want to completely validate that. It is tough. It is stressful, right? It is a full-time job on a full-time job on a full-time job. Right? And it's frustrating. And I hear that from women or patients in our clinic every day. It's it's hard, really hard, because especially as women, we're conditioned to self-blame a lot. And when we are the ones who are going to be getting pregnant and then it's not happening, it's very easy to turn that shame and blame inwards. So from a nutrition perspective, though, how do we use this as an anchor to keep us steady? Because food, yes, there's nutrients, but food really is necessary for survival. And we're in survival mode sometimes at that point, right? So how do we nourish ourselves through that? And at the very, very baseline, I always say, and this applies to whether it's infertility issues or postpartum, when you're in a little bit of survival mode, that like fed is best, period. So before we even talk about macro, micronutrients, food groups, right? It's like, are you eating, period? Because if we're not, and we're so frazzled and we're wired and tired, and then, reproductive function is going to shut down. Because guess what? It's not actually necessary for your survival as your body, right? So if your body's like, okay, I'm not getting enough nourishment, my gas tank isn't, I'm going to prioritize my brain, my heart that's going to be pumping, right? My muscles, right? Not necessarily ovulation as well. So that first baseline is, I have a woman come to the door, through all the door all the time, and they're so wonderful, and they try so hard, and they're so motivated, and they're like, okay, I'm taking all the supplements, I'm exercising, I'm sleeping, and then we look at their dietary history, and they're eating maybe like a really light salad at lunch, and they're like, okay, I got my antioxidants check mark, and maybe they're eating like a soup, right, for dinner, and when we look at how much that actually is from an energy density standpoint, it's quite low. So it's very low energy availability, right? So the body needs to function. So fed is best. How do we find the right energy intake for you, right? Given your age, sex, activity level, and then navigate things like appetite, stressors, day to day, your job, right? And then second piece is, how do we notice, on that note, build some structure into our day to fuel. So stabilizing blood sugars is a big piece of fertility support, right? And when it comes to stabilizing blood sugars, meal timing is a big piece. So at the very least, okay, if we're starting from a lower baseline, how do we integrate breakfast? Everyday breakfast, I always recommend for anyone who's trying to conceive, right? As a woman, eat your breakfast with protein, with fiber. That's going to stabilize your blood sugars. That's going to associated with regulating your cortisol levels later on in the day. And then after that, how do we systematically eat in a structure so that our blood sugar is a little bit more stable? It's a little bit of a low and slow rise and fall. There will be a little bit of rise. Let's not fear it. Okay, it's just going to be a little bit, and just give your energy and go back down. And then how do we also notice if we struggle with maybe low appetite, or we're fearful of food, right? Or maybe there's a little bit of compulsive eating because we're stressed. How do we now address that compulsive or emotional eating? And I want to be very clear, like, emotional eating gets such a bad reputation. It's not a bad thing. Like, I love emotional eating. So, it's like, also, it's not always, there's the birthdays, there's the holidays, like, enjoy that nourishing, stew and the soup. And, for me, it's like noodle soup, right? But also, it's also okay if you go home after a stressful day and you're like, I want chips.
Right.
Like, it's actually really interesting what we accept and don't accept as emotions, right? Like, it's okay if we eat when we're happy for emotions, but not when we're sad. But it's more about bringing awareness to that, right? If you're really stressed because of fertility challenges and you're finding comfort in chips, do you actually, one, know that's happening? Or two, is it that you dive in, you look down, you didn't realize how it tasted, and now it's suddenly gone, and you're like, what happened? I was just numbing that entire experience, right? So that intention and then awareness matters. And that is another piece that I would say, okay, fed is best. Start with nourishing baseline, get your breakfast, and then really be honest with yourself and work through any of those compulsive eating patterns, right? That can really keep us in that cycle of then we feel guilty and shameful and the stress continues, right? And it's a really uncomfortable cycle to be in. I would hate for anyone to be in that on top of the stressors of trying to conceive, right? So that's what I would say to them.
Right. Talking about not eating enough and feeling guilty about it, I want to talk about pregnancy first trimester.
Oh, yes.
So I remember my morning sickness was really bad. I would throw up. Before even throwing up, it was nauseous. And I had aversion to smell of coffee, smell of oil. I could not open the fridge because even the smell of that would just make me throw up. So I hardly ate. And it's natural to lose weight, but I was so concerned. I was like, okay, is it going to affect my baby? Because it's growing.
Yeah.
And especially the first trimester is when, like, it's very crucial, right? Until week 12. So, and then I was told that baby is going to take whatever it needs from the mom. So a lot of women out there who are in their first trimester have the same feeling that they're not able to eat. And at the same time, they're worried if that's going to affect the growing fetus. So what would you tell them?
Yes. Oh my goodness. I always say your body is resilient,
Right.
your body is so much stronger than you think it is. Like, think of evolution, like how we got here today, our ancestors, right? Who gave birth without modern medicine? Like, imagine that, right? How we got here today, and we're fine, right? So I can completely empathize with, once again, back to that, women were conditioned to be like, okay, we need to do everything perfectly for our family, our child. We're the one who's growing us in our womb, and it's a beautiful process. But we also have to remember that you don't have to do it all. These are really, really, really hard challenges. When you wake up and you want to puke, like, you're not eating a nutrient-dense large meal, right? If water makes you want to puke, like, you're probably not going to drink enough water, right? But know that your body is resilient, it's adaptive, and like you said, absolutely, the baby will take what it needs from your mom. So think, and also actually from a more clinical nutrition perspective, your caloric needs actually don't increase in the first trimester. It's only in the second and third that it's extra 450 to 550 calories per day, right, for the growth and development. It's that micronutrient store, which, one, back to the prenatal, why it's so important to trust the process, right? Surround yourself with positive stories. I think there can be a lot of shame. Anything that's making you feel like you're doing something wrong, right? That's online or an influencer or social media. There's a fine line between aspirational and like inaccessible, right? Then unmute, unfollow, unsubscribe, right? And trust the process, lean into your body. It's a beautiful time. You're going to be okay, is what I always say. Yeah.
Right. And then we move towards, we're done with the first trimester, done by week 16. Done with the morning sickness, and then you're moving towards the second trimester, and the craving happens. And again, I craved so much. My craving was for sweets. And my mother-in-law was kind enough that she would bring like big jars of those Indian sweets. And I was binge eating. Yeah, I would just binge eat. Like, in one go, I would have like 10 laddus or 10 kaju katli, whatever. And by week 20, I knew I had to, there was like a blood sugar test that had to be taken. I was so concerned, what if I end up getting gestational diabetes? And I ended up asking the doctor, and he's like, okay, for a South Asian race, I guess you should cut down because they are prone to it. So especially like women who are in their second trimester and who, they have cravings, so you can't control it. So how can they mindfully eat, like satisfy the craving, at the same time be mindful of what they're eating?
Yeah, such a good question. And like, hey, those hormonal cravings, I'm not one to say, like, try to like mindfully eat your way out of it. Like, no, it's more about, okay, how do we add a little bit more protein into our day? So that way you're stabilizing the blood sugar response after eating. How do we once again go back to nutrition by addition so that if you are craving the laddu, or I have a friend who was like, oh, chocolate croissants right now, like that's her thing, right? She's like, but I'm not feeling guilty about it because I know I'm having protein at breakfast, because I know I'm also incorporating other nutrient-dense foods that my body needs, right, at this phase. And I am allowed to enjoy these foods on top of that too, right? So back to usually, or hopefully, the nausea, oftentimes it's most intensive during the first trimester, right? Where you're newly pregnant, all those hormone fluctuations are coming. So how do we now, I'm working with women to, second trimester, if you weren't able to tolerate breakfast, or maybe you're transitioning now, how do we add a little more protein into the morning? That way it's going to blunt the effects of free sugars coming in later, right? Maybe that's having something that's liquid, like a smoothie, that's cold, that tends to be easier to tolerate, both cold and liquid. If you are craving a sweet, let's say 2 p.m., 3 p.m., but also practice, a little bit of like reflection. Did I have lunch yet? Whoa. Did I not? Or did I have something really, really light for lunch? Maybe let me just have a lunch and then have the laddus, right? So that way we know it's also not intensified by hunger. So there's the craving because genuinely food tastes good, right? Another thing is sometimes you're like, oh, how do I fix this craving? I'm like, these foods are designed to taste good. You're human. You have taste buds. But sometimes they can also be intensified by, one, hormonal condition fluctuations. That's mainly outside of our control with pregnancy. But two, genuine hunger, which more so is at our control, right? So always think, when was the last time I ate? Has it been a few hours? If it has, maybe I'm genuinely hungry. And then afterwards, is that craving still there? If not, okay, we can move on. If so, great. Now we're enjoying it. Right. So a little bit of thoughts around that, and especially with, gestational diabetes, right? There now you don't eat, there's a common myth that it's like, once again, the fault of the mother or the woman, right? We know there's so many risk factors One, if there's one theory is the early, pre-pregnancy, if there's insulin resistance or PCOS or a family history of diabetes, then you are at a higher likelihood for gestational diabetes. But two, also the placenta releases hormones that impacts your body's ability to use insulin too. So that is completely just a hormonal shift on its own, right? So for anyone who's listening who's like fearful, try to practice nutrition by addition. Eat, enjoy your craving, right? Enjoy the foods, no guilt, add some nutrition to that. And also know that there are some things that are within your control, some are risk factors that aren't, and that can be freeing in some ways.
Right. Understood. So again, talking about PCOS, which you just specified. So again, so much information, like no carbs, no dairy, no gluten. And literally it's like no joy and no happiness.
Oh, I know.
And it becomes so difficult. It sounds like a punishment. So especially when they conceived and they are in their second trimester and they have a craving. Because consciously, like even for a person who is normal, who do not have a PCOS, they get concerned. So if someone with PCOS gets magnified, it's like my blood sugar is going to spike immediately. I want to have that ice cream. I want to have that bagel. I have an impulse to have. But at the same time, they're concerned. So how can they balance?
Oh, and that's a completely valid concern because we know with PCOS, it's interesting because it's framed as just a period issue, as just a fertility issue. It's like, they're like, come back when you want to get pregnant. For now, just lose weight, forget about it. But it's so much more. It increases the risk for type 2 diabetes, heart disease, for endometrial cancer, because guess what? If we're not having our period, we're not shedding our uterine lining. That builds up and thickens, right? And absolutely, there is that very valid fear because we do know insulin resistance, which impacts our body's ability to process sugar in our blood and turn it into energy. It is present in up to 70% of people with PCOS, regardless of body size. So, that said, yes, there's increased risk factors. But on the other end of the spectrum, back to what we're saying around, like we live in the information age where there's so much misinformation, right? Sometimes we go to the other end of the spectrum where it's like, I can understand thinking, okay, eating carbs increases blood sugars. So if we don't want it to be high, let's just not eat any altogether. But that's not necessarily how our body works. Our body actually needs a little bit of carbs or a moderate amount of carbs spread out throughout the day because guess what? That's your body's primary energy source, right? So it's not that we don't want any carbs. It's just three things to think of. One, what is the type of carb that we're eating? Is it a slow digesting or a quick digesting?
Okay.
If it's quick digesting, if we're eating a ton of it all the time all at once, maybe that will increase blood sugars over time and worsen peace outcomes. But two, are we eating high fiber carbs? So things like whole grains, yams, starchy veggies, yams, cassava, sweet potato, wild rice, buckwheat, quinoa, fruits, right? And two, with carbs, are we spreading it out throughout the day? Eating all your carbs in one sitting is very different from spreading it out throughout the day, right? Because that's going to give you that low and slow energy rise and fall. And three, are we pairing it with protein and fats? So usually with some protein, with some veggies, and that's going to help create that whole, blood sugar response, which is a little bit more controlled. So think of that piece when we're pairing, even if it's a low, quick digesting carb with protein, with fat, it's truly, it's greater than the sum of its parts, right? That's going to have a much better blood sugar response than even eating a slow digesting carb on its own.
Right. So rather than eating 3 big meals, we need to just break that down into smaller meals and keep eating throughout in smaller quantities.
Either or, people respond to different things, right? So my point is definitely more than 1 meal a day. So what I see is most common is in the PCOS population, we're taught to, no carb, calorie restriction, no dairy, no gluten. So then they don't eat enough at all. So maybe at breakfast you skip, you're having coffee. Lunch, you're having just veggies, salad. And then 4 p.m. hits, and then it's continuous snacking, large dinner, and more snacking.
Understood.
And what that's going to cause is blood sugar low, shoot up, and then insulin then shoots up.
Right.
What could it look like instead is I usually do recommend a structure just to start with 3 square meals a day. How is your body responding? How are your blood sugars responding? How's your energy, your fatigue, all these other markers, short-term and really quick markers. Like your body tells you right away, energy-wise, digestion-wise, if something's working or not. Right? So 3 square meals, try that out. if you do, your body's calling for some snacking in between, absolutely integrate a strategic snack in there as well. And that's going to keep it low and slow and steady. And on that note, with insulin, like, insulin resistance, it's funny because insulin resistance is increasingly common. But insulin on its own is not actually meant to be harmful. Very much like cortisol, very much like stress, because it is a necessary hormone. We would not simply be alive without insulin, right? So think of insulin, it converts energy into, converts food into energy for your body. So think of it as like a coworker, right? You have a new coworker on your team, they're helping push things to the deliverables and the deadline. But when your body stops being responsive to insulin, it's not as effective, but it keeps going. It thinks, okay, I just need to release more. I just need to keep working harder. So imagine now that coworker now is working on overtime. They start putting their hands in projects that they're not assigned to. They're messaging you at all hours of the day, right? And they're creating a lot of chaos in the office. So that's what insulin is. A little bit is okay, or a good recommended amount, right? That is our baseline, but too much of a good thing can then become a harmful thing.
Right, understood. Also, again, talking about the insulin resistance, PCOS, 70 to 80%, the core reason is insulin resistance. But there could be other reasons like family history.
Yes.
Could be inflammation. So how true is that? So insulin alone is not the major factor.
It's not. So it is just a feature of PCOS. So PCOS is a hormonal condition that essentially impacts how your ovaries act. Right? And that could lead to, the features are things like anovulation, so missing periods, things like facial hair growth, acne, male pattern baldness, and oftentimes has features of insulin resistance and low-grade inflammation. Now, there's also psychological features. Like, we know that people with PCOS are much more likely to have eating disorders, to have depression, anxiety, right? And it's like the chicken or the egg, right? Because living with this syndrome is very, very, very tough. And that is absolutely a risk factor for depression, right? It also has dermatological features, like I mentioned, increases the risk for diabetes, heart disease. So when it comes to, sometimes people are like, why do I have PCOS? Why me? And it's tough because the answer is I don't know. And you know what? Like, let's, though, given what you were dealt with, how do we build your toolbox so that you can manage it to the best of your ability and still live a filled, wonderful life and on health by your own terms as well, because it's genetic, it's environments. Now there's even research to suggest that in utero exposure to potential endocrine disruptors, right, are associated in addition to family history. If you have a mom or aunt with type 2 diabetes, you are much more likely to get PCOS. Sometimes it's an environmental trigger that activates it, right, if we are predisposed to it. So I think, speaking healthcare broadly, and I always use the same analogy as mental health because I think everyone deals with mental health, right? Not everyone deals with PCOS or hormonal disorders, and there's no one root cause. And I know marketing, buzzwords, root cause really pulls people in, but that's like saying, what's the root cause of my depression? We don't know. Maybe it's adverse childhood events mixed with family history. Right?
Understood. Yeah. So it's also PCOS is much beyond irregular periods. Like you said, it just doesn't stop after pregnancy. It continues in 30s. It could continue until 40. Like you said, that could be long term, like heart disease, diabetes. So how can women focus on their health long term?
Oh, I love that question. I love it because we're in it for the long game. Life is not that short. It's the longest thing we'll do, right? So how do we support our health and, our lifespan, our health span? So when it comes to supporting women, how do we support them long-term is one, building back to foundations and being very, very honest with yourself and maybe doing a little exploration on what health means to you long-term. So as an example, oftentimes we'll have patients walk through our door and say, I want to lose weight. My doctor told me to lose weight, or I want to lose it for aesthetic reasons, or, I just want to, it's the summer, right? There's all this talk about bikini season. Right. And we're like, okay, we hold space for that. Absolutely. That's totally valid, right? And then throughout our work together, when we dive a little bit deeper as to their why, like, why are you really here? What do you really value? We unpeel so many layers. It's like, oh, it's actually not aesthetic. I actually just want to feel strong again. It's been so long, right, since I felt like myself. I want to feel more energy and I don't want to be tired when I'm chasing my kids around. And one day I know I'm going to have, I'm a huge family person. I know I'm going to have grandkids. I want to be able to chase them around and take them to the beach and the park. I want to play soccer again. I had a patient the other day and be like, oh, I used to, I loved intramural soccer, but my knees hurt now. So it's all these other things that are beyond the scale, that are beyond chasing a number because someone told you to, or because that's an Instagram influencer's version of health. So what is actually important to you, and only you know that too. And maybe it's the first time that anyone's actually asked that question and held that space for you to explore your health values, because it's part of your identity and your values as well. So really, go back to answers like you, right? So if you were to ask me, how do I support my long-term health? And I'm like, okay, what is long-term health for you? What do you care about? When you visualize yourself 70, 80, what does that look like? And if we were to reverse engineer that, how do we set up those foundations so you can get there seamlessly, naturally, right? There may be a little bit of gentle effort, but it shouldn't ever feel really stressful or like you're doing something super, super, super hard too, right? So it's back to those, oftentimes those pillars: nutrition, gentle nutrition, I like to call it, exercise, movements, right? We talked about that. Stress resilience, right? Our nervous system support, right? And then sleep. Oh, sleep is a big one. Yeah, that's a tough one with the screens these days.
Right. So it's all about setting the foundation, right, is what I understand. Right.
Absolutely.
And does it have an impact with breastfeeding as well? Like, because I, again, read somewhere that women with PCOS, they have issues with the milk supply. So is it true, or is it just a myth?
Yeah, so there actually is some studies to suggest there's a correlation between lower milk supply and having PCOS, right? And that said, it's not impossible, just in the same way it's also possible to conceive with PCOS. Right. We've had plenty of patients who've been able to breastfeed exclusively. We've had some patients who, what better works for their family is to do a mix, right? Or some who decide to do bottle feeding or formula feed, and that's totally okay too. So I think part of that is we support the best what we can. We control what's within our, what is actually within our control, right? And then it's okay to surrender to the rest who would not adhere to this external expectation of what being a woman should be or what being a mother should be, right? Because it's just by being you, like, that is womanhood, right? Like, you are a woman, right? You are a mother, so you can decide, what that looks like.
Yeah, whatever works for you, that's what we need to incorporate. Yeah, it's so true. Talking about vitamin D, we don't talk about this much. Again, I happened to read a research article which said vitamin D deficiency, it could have an impact on fertility health.
Absolutely.
It's true?
So there is a correlation between vitamin D and reproductive function. And it's actually so interesting because living in Canada, right? Like, if anyone here is, Canadian or not, or tuning in, it is actually a public health recommendation for everyone here to take a vitamin D supplement in the fall and winter months. And just on a side note, take it with a little bit of fat, right? Because it is fat soluble. We want to absorb the best we can. And we don't necessarily get enough from fortified food items in the food supply here. So absolutely, like, we typically think of vitamin D as essential for bone health. It helps, works with calcium, phosphorus, magnesium to maintain our bone density. It helps with immunity. It helps with mood. But actually, more research absolutely is suggesting the link, especially in patients with PCOS, correlation between low vitamin D blood status and ovulation as well. So correcting that deficiency, now you can get that blood tested easily, right? And it tends to be very easy to correct if you aren't necessarily responding to over-the-counter supplements. Sometimes there are cases where you can get a high dosage that's medically supervised, or even injections as well. So super important. It's almost like funny because it almost feels like silly simple, but because everyone's like, oh, I know I need to take my vitamin D, and they kind of roll their eyes right there. And like, sometimes we forget, and we're a little blasé about it, I find, in Canada, that like, no, it's actually impacting the PCOS. Right? It's so much deeper than like bones and mood and immunity, which are also impact your PCOS too, right? But it's just another, I guess, reason why, right? Another piece of motivation to take that supplementation.
So if you've not been taking vitamin D, you should start taking vitamin D from today.
Yes.
And moving on to postpartum. Culturally, or more so South Asian, I would say, not sure. So we have strict diet for 40 days. You're not supposed to eat yogurt in the night or curd in the night. Or you're not supposed to have certain specific foods, which is not good for the baby, or it's not good for you because you're feeding the baby. So is that strict diet actually required? Are we supporting the mother, or is she becoming more weak?
Such a good question. It's so funny that you mentioned in South Asia, there's one way, and then in Chinese culture, we also have our traditional confinement period, right? Where the mother's really just resting 30 days, also very similar. I don't want to call them food rules, but food guidelines or recommendations. Instead of no yogurt at night, it's warm foods only, ginger, red dates, right? There's functional properties and recovery and replenishing blood loss. So I think there is a lot of validity to traditional healing practices, right? It's so interesting when we look at nutrition science and research. And yes, there are a range of studies from high quality to low quality. But in terms of what's been funded traditionally here in North America, it is a very Eurocentric model of care, right? The Mediterranean diet, for example, absolutely, it is anti-inflammatory. It helps, it's associated with improved fertility and recovery, right? But I'm pretty sure you could find similar outcomes from other parts of the world using same principles and same food groups, right? So when it comes to cultural healing traditions, if it's something that I always say that one is something that's passed along from your family, two, that you really feel cared for, you feel nourished, not just physically, but spiritually, emotionally, mentally, you're recharging, absolutely. Because it's part of, there's the nutrition, but there's something healing about continuing something that's a shared history between you and a whole community of people, right? There's something beautiful about reflecting and honoring that. And I think there's a lot of health that is found in that practice as well.
Nice. So that pretty much brings us to the end of this episode. And this was such a powerful and insightful conversation. And I'm very sure that people who've been listening, they're going to gain a lot of insights from it. And whichever phase you're in, it could be trying to conceive, it could be pregnancy, postpartum. Your body is just trying to help you. So have balanced meals and you should be fine. So you don't have to worry. You don't have to feel guilty. You don't have to have the food fear of what to eat, what not to eat. So listen to your body. And until next time, until next episode, thank you so much for watching. See you soon. Thank you.